All right, it's 1:30. Hello, everybody. Thanks for joining us today. My name is Chris Casey. I work at NetCentric Campaigns, Washington, D.C. based nonprofit organization, and the people who are working to develop the Halt the Harm network. We've got a very interesting and timely webinar for you today, and I'm just the guy kicking things off, and I want to tell you briefly about the Halt the Harm network. Halt Harm Network is a people-oriented, service-oriented network designed to provide support to leaders who are working to provide support and collaboration among the individuals who are working to halt the harms of fracking. We bring leaders into the network by providing services and supporting the resources and techniques that they use in their work. And as you can see here, we facilitate connections between leaders, help find opportunities to build ties, trust, and collaboration among them, and help bring them together, working together. An example of one such service is the Halt the Harm Leader Directory. Within the website, leaders within the networks are given an opportunity to build a profile, and they have a login to the page that allows them to find other leaders based on geographic region or areas of expertise or means of collaboration. And again, ultimately, one of the goals of the network is bringing together individuals and hoping to find ways to encourage and promote their collaboration among each other in ways that wouldn't have otherwise happened. Ultimately, as the network grows with leaders, we want to help the leaders with their campaigns, whether it be local or regional in their city or township, statewide or national, in efforts to reach out to people, increase their own capacity. And so we'll be working with leaders to identify the campaigns, whether they're submitting public comments or getting people to attend particular events, and by increasing the general capacity of all the leaders within the network through this kind of support. And then one of the services we'll provide will be webinars such as today's. This is the first of what will be a series of what we expect will be 5 webinars over the coming months, and we're very excited about the panel we have today. We'll be introducing them individually each as they come up, but today's topic is the health harms of fracking. The way the webinar will work is each of the panelists will speak for approximately 15 minutes. You should, in your control panel on the right-hand side of your GoToWebinar, see a screen where you can submit questions. So please feel free to do that anytime during the webinar. At the end, the final portion, the final 15 minutes, will be dedicated to addressing those questions. We will answer as many of them as time allows, and the whole webinar will be recorded and made available online. So if you're listening but not actually here, or if you weren't able to make it, you'll be able to follow up. And with that, we're going to pivot to our first speaker. Sahru Keiser is a program manager with Breast Cancer Action, and we're very happy to have Sahru join us today.
Thank you so much. Thank you to the Halt the Harm Network for sponsoring this really important webinar, and thank you so much for inviting me to present today. My name is Sahru Keiser again, and I am the program manager here at Breast Cancer Action. So a little bit about the organization I work for. Breast Cancer Action was founded 25 years ago by a group of women living with breast cancer who realized the power of community. They found the organization because they really saw a need for grassroots organization with a unique understanding of the political, economic, and social context of breast cancer. Now, we're really the only organization that addresses the breast cancer epidemic at the intersection of breast cancer, the environment, social justice, feminism. And our mission is to achieve health justice for all women at risk of and living with breast cancer. We got involved in the anti-fracking movement because we believe that it's one of the most important and growing pathways of exposure to cancer-linked chemicals that endanger our health and increases our risk of breast cancer. That is fracking. Most people consider fracking a climate change issue, but fracking really threatens the necessities of life. And so just as fracking drives climate change, it also increases our risk for breast cancer. I think many of people on this call are familiar with the process of fracking, so I'm actually going to sort of jump right in and talk specifically about the toxic chemicals involved in fracking and really what their links are to health harms, including breast cancer. So thanks to the compendium of scientific, medical, and media findings demonstrating risks and harms of fracking, which was released back in December by the Concerned Health Professionals of New York, we know that there are more than 700 chemicals used in fracking, and I've put them up on your screen. They include carcinogens, plastics, neurotoxins, hormone disruptors, heavy metals, and radioactive agents. Many of the chemicals used in fracking are associated with breast cancer, and 50% of them actually cause nervous, immune, and cardiovascular system problems. So in our highly interconnected, highly interdependent world, fracking really threatens the health of each and every one of us. Now, of the 700 chemicals I just mentioned, 25% of them are actually linked to cancer, not just breast cancer, but cancer in general. And one I want to pull out and talk about is benzene, which we know is a carcinogen. It's a known carcinogen. Now, benzene has been linked to male breast cancer through occupational exposures, and it's found in high levels in the bodies of workers at fracking sites. We know there is no safe level of benzene. Even the American Petroleum Institute's own toxicology review says that it is generally considered that the only absolute safe concentration for benzene is 0. The U.S. Environmental Protection Agency, the EPA, has set a maximum contaminant level goal of 0 for benzene in drinking water. And yet recently in California, it was found that regulators allowed hundreds of injection wells to dump industry wastewater into aquifers that contain water clean enough to drink or could be made drinkable. Those wells should have been protected under the Federal Safe Drinking Water Act, but the Halliburton loophole, which many of you may have heard of, actually exempts the oil and gas industry and allows them to do this. We believe, as I'm sure many people do, that cancer-causing chemicals like benzene really have no place in California's water supply and any water supply for that matter. So fracking is growing. The scale and pace really threatens the health of everyone in the U.S. Not only are millions of families that live in communities right next to fracking sites health on the line, but we're all at risk because water that is pumped from fracked areas goes to cities all across the U.S. And as fracking in agricultural regions contaminates food that we put on our tables, it also contaminates the air, and it carries those contaminants in unpredictable and untraceable ways. A little bit of information just to help you understand sort of the movement and the growth of fracking. 10,000 fracking wells have been drilled since 2000, and that actually places 15 million people within a mile of a fracking well. And that number really just continues to grow as the oil and gas industry grows. Environment America calculates that there are 82,000 wells in 17 states that have been fracked since 2005, and that over 22,000 new fracking wells were drilled in 14 states just in 2012. So fracking is really producing a toxic and radioactive legacy that threatens our health for years to come. And there's no safe option for dealing with the fracking wastewater. These chemicals are not biodegradable. Once they're pumped underground and released into the environment, they can contaminate our drinking water. And we have no way of cleaning that water once it's contaminated. And like I said, we just saw this in California. So what are we doing, and what's our work? We're committed to addressing the environmental causes of breast cancer in order to stop breast cancer before it starts. And so our campaign work around fracking is really focused on helping build the anti-fracking movement and achieve an end to this harmful practice. It's important to us as a breast cancer organization to really connect the health harms to fracking and to move beyond just the climate, but also understand the health harm to people. So we were a founding member of the Americans Against Fracking Coalition. We've also in the past been involved with the Stop the Frack Attack. And at the state level, because we're located in California, we're very involved with the Californians Against Fracking. Actually, recently, along with the coalition of 150 environmental health and public advocacy organizations in California, we are seeking to compel Governor Brown to issue an emergency moratorium on fracking in the state. And we submitted a legal petition, which is actually up this Thursday. So I hope if you're in California or elsewhere, you'll look to see where that issue goes. We also support a federal bill to protect our public lands, which was introduced to ban fracking on public lands. And we also support the reintroduction of the Frack Pack, which is a couple of bills that would close the loopholes in our major environmental laws, some of them that I mentioned, the Safe Drinking Water Act, as well as the Clean Air Act and the Clean Water Act. I want to talk about a very specific example that really connected a number of the pieces of work that we do here at Breast Cancer Action. So last October, we were surprised to learn that the fracking giant, Baker Hughes, announced a partnership with the Susan G. Komen Foundation, where they painted 1,000 drill bits pink for breast cancer awareness and donated $100,000 to Komen. We were really shocked by this extreme example of pinkwashing, which is where a company claims to care about breast cancer by selling a pink ribbon product and at the same time produces, manufactures, or sells products that are linked to the disease. With our partners at EcoWatch, Oil Change International, Food and Water Watch, and Credo Action, we collected over 168,000 petition signatures, and we delivered them into the Komen affiliate in Pittsburgh, Pennsylvania. They were planning to accept the check at a football game in Pittsburgh. We also held a rally with anti-fracking activists and women's health activists there at the football game. It was the Pittsburgh Steelers football game where they were scheduled to accept it. We were also featured on The Daily Show with Jon Stewart talking about why pink drill bits for the cure are ludicrous and really not the solution to the breast cancer epidemic. So sort of moving towards my conclusion, I just want to restate our position here at Breast Cancer Action. We oppose fracking because the practice exposes people to endocrine disruptors and carcinogenic chemicals that are linked to breast cancer. We believe that in the interconnected world that we live in, we are all vulnerable, and the health impacts of fracking are not limited just to rural communities where fracking is happening. And last, while we may not know everything about the long-term health impacts of fracking, we certainly know enough to take action and to urge state and federal regulatory agencies to protect the health of its citizens and to ban the health-harming practice of fracking. I wanted to talk about a few resources that we have at Breast Cancer Action. You can go to our website and click on the Stop Fracking page and find more about our position and some steps that we're taking in ways that we're mobilizing our membership. We also have a one-pager around breast cancer and fracking. We also had a current article in EcoWatch that really explains why fracking is a breast cancer issue and why it's important to us. We had a webinar. It's a little old, but the issues are still important and still relevant, called Fracking and Its Connections to Breast Cancer. And some of the other organizations that I mentioned that we're a part of, Americans Against Fracking, Stop the Frack Attack, and Californians Against Fracking. The website is there up on your screen. So I'm going to end there and say that I really appreciate this opportunity to talk about the health harms of fracking. I think they're very important. And if you have any other questions, you can contact me directly, or you can also go to our website. Thank you very much.
Thanks very much, Sahru. As a reminder to everybody in the audience, we'll be taking questions during this webinar as well. You can use the chat window on your control panel, and if you have the little menu set to send questions to staff and submit those questions, they'll queue up there, and we will get to those questions at the end of each of our speakers' presentations. Our second speaker today is Leni Resick, who is a family nurse practitioner with the Southwest Pennsylvania Environmental Health Project. Welcome, Leni. Thank you for coming today.
Thank you, Chris. I'll be speaking to you today on unconventional natural gas development and emerging health issues. I am the family nurse practitioner at Southwest Pennsylvania Environmental Health Project, and we're a nonprofit group that we opened our doors in 2012. And our mission is to respond to individuals and communities' need for access to accurate, timely, and trusted public health information and health services associated with natural gas extraction. Now, these are some photos from the community in which we work, just to put the talk into context. And to save time, I only picked 6 of these. And the one on the upper left is a industrial site activity near a home. And the one in the upper middle is flaring, and the one on the right in the upper is the open pits and impoundment. On the lower left is a condensate tank, and then to the right of that is a metering station, and to the right of that is our pipelines. And these structures are all involved in the steps of unconventional natural gas development. And the exposures include actual fracking, and a lot more. Excuse me. So our primary purpose is to respond to individuals in need, to assess individual health issues, to identify pathways of environmental exposure from unconventional natural gas development, to do air and water quality monitoring, and currently under development we're looking at impacts on the soil. And we work with residents to manage and improve their health and well-being. Communities that reach out to us include regional watershed groups and residents concerned about the placement of unconventional natural gas development in their communities, groups and residents specifically concerned about the placement of activities near schools. We also work with residents in West Virginia, Ohio, and New York. Now, with residents and communities' permission, we aggregate data, and this aggregate data are collected on health, air, and water impacts. And we seek to establish strong associations between the presence of surrogate chemicals, particulate matter, and also health impacts that are associated with the chemicals identified as part of unconventional natural gas development. I wanted to talk a little bit about particulate matter, and these are fine particles like the dust in the air when the sunlight comes in the window, but a lot smaller. And the small size of these particles determine the depth of inhalation into the lungs. And the smaller the particle, the deeper they can go into the lungs. And when this particulate, these can combine with absorb airborne chemicals in their midst. The more water-soluble the chemical is, the more it is likely to be absorbed into a particle in combination into the lungs. Oops. So residents have come to us experiencing symptoms that come and go. A lot of these are respiratory, headaches, nausea, skin rashes, and many factors contribute to these symptoms. These include variable emissions over a period of time of day, and also depending on the weather. Also, the homes, many homes are surrounded by multiple sites. Weather can also cause patterns of variability. Keep in mind that the topography in southwestern Pennsylvania has many hills and valleys. And these hills and valleys, plus the weather and wind patterns, can also cause many different patterns of variability of air exposures and symptomatology. This is an overview of some of the health issues that have been in the literature. And where the little stars or asterisks are, these are where our findings are congruent with the literature. And these are some of the findings that I'm going to talk about in a minute. I'm going to talk about our health assessments, and out of the people that there's 113 people who met screening criteria. And these assessments that we take for the health findings include a full health history of the client. We record vital signs and symptoms. We also document if the occupational exposures and also household exposures. And we make recommendations for further medical consultations. And we also educate about ways to cut off exposure pathways of air, water, and soil. So we did an analysis of the data that we collected. In the next two slides, I'll be talking about these. These are acute symptoms. This was an inventory we took of 113 people who met screening criteria. Now, this screening criteria is not intended to be research. That is, there were no control populations to compare. We were responding to people who think they may have been exposed. So this is more like a case study, a case series, or public health investigation of outcomes, and that type of investigation. So what we found were symptoms related to the lungs, skin, eye, nose and throat, gastrointestinal, and constitutional symptoms like fatigue, weakness, and weight changes. And I'm going to go into these in more detail. We also had our patients complained also of cardiac symptoms, neurological symptoms, especially headache, mental health symptoms, endocrine symptoms, and symptoms related to hearing. So to be included in these 113 people, we were sure that a complete health history was taken on each individual, and the majority of these exposures were environment, 97%, with a few occupational exposures, and that was 3%. And we wanted to make sure that there was a potential exposure to unconventional natural gas development had occurred, and that the symptoms were present where there may have been an exposure. So these symptoms were reported on adults. We've collected little data at this time on children and pregnant women, but we hope to do this more often in the future. And we only saw a handful of workers because most of the workers are typically seen first by occupational medical providers at their work site or in the emergency room. So out of the 113 people, these were the types of symptoms, the individuals reporting, and the percentage of cases. Now this won't add up to 113 because there were overlap of symptoms. Most people, not everybody, had more than one symptom. So I will go through each of these in more detail in the next 3 slides. So with the breakdown of symptoms, 60 people out of the 113 reported respiratory symptoms, and this was 53% of the cases. And of these 60 people, 63% reported coughing, and there was also reported shortness of breath and reported wheezing. In regard to skin, that was 49% of the cases. And of these people, most were rashes, and these rashes also had associated itching with it and burning. 39% of the cases, 44 people or 39% of the cases reported eye problems, and the eye problems were mainly related to itching and burning and blurred vision and also dry eye. As far as cardiac, we had people reporting cases, I'm sorry, I'm ahead of myself, nose and throat. People reported sore throat, sinus pain, and nosebleeds. 56 people, or 50% of the cases, this was 50% of the cases. Of these, 46% reported nausea, 38% abdominal pain, and 20% reported diarrhea. Of the constitutional symptoms, that was 40 people, or 35% of the cases. 40 people reported fatigue and weight gain or weight loss, some type of weight change. So the symptoms that were reported might be persistent. They might have been transient. They might have been intermittent. But these variations in symptom presentation are consistent with the changing and episodic nature of the exposures. And to the right is an example of a spec monitor screen that shows the peaks of particulates in the air over a period of time. And these peaks often correspond with the symptomatology. And the cases are based on concern of residents or evidence of exposure potential. Again, not a random survey of all residents in Washington County. Now, although the shale gas industry is not unique in emitting multiple pollutants simultaneously, this industry is unique in doing so as close as 300 feet from the edge of a well pad. So from the literature, we know that particulates, chemical radiation can have health consequences, some from high, short-term, perhaps repeated exposure, and some from low-level chronic exposures. So both chemicals and non-chemical exposures produced by gas drilling activities pose health risks to humans and animal living close to the gas production areas. And with rapid change resulting from the introduction of resulting from introduction of gas drilling activities into rural communities, this carries a risk of social disruption and mental health consequences. So, in conclusion, residents need to know and understand conditions that make them susceptible to adverse health effects. And at EPH, we provide or recommend the following: real-time air and water monitoring, devices to remove particulate and gases from home air. We provide air models to determine periods of high risk. We also give guidance for cleaning homes. We offer support systems for worry and anxiety, and also offer warning signs for health effects. And we also refer access to appropriate medical care. This is our team. We're located in southwestern Pennsylvania. There's also a portion of our team in Maine and in Connecticut. And for more information, here's our contact information. Thank you very much.
Thank you, Leni. I really appreciate that. Again, just a reminder to everybody as we pivot to our final presenter today. We'll be addressing questions at the end of that final presentation. Use the chat window in your control area there to send questions to staff, and questions you submit we will get to following our final presentation. And that presentation's by Gina Angiola, who is a member of the board at Chesapeake Physicians for Social Responsibility. Thank you, Gina, for joining us today.
Thank you, Chris. Thank you, Sahru and Leni, also for sharing your important work, and the Halt to Harm Network for the opportunity to participate in this webinar today. As mentioned, my name is Gina Angiola. I'm a retired OBGYN physician, a board member of Chesapeake Physicians for Social Responsibility, and a co-founder of Concerned Health Professionals of Maryland, a group that formed quite recently to amplify the voices of health professionals in Maryland who are concerned about fracking potentially coming to our state. We in Maryland are deeply disturbed by the reports we're hearing in other states, both through formal and informal networks. I hope to share information today about actions that are currently underway in our state, in fact, literally as we speak today, and those actions grew out of this emerging health information. So if I may, I'd like to begin by sharing a bit of recent history regarding fracking in Maryland. We were very close to the first wells being drilled about 4 to 5 years ago in Garrett County in the western part of the state, but citizens spoke up and the governor responded by putting a 3-year moratorium in place to study the issue further. Specifically, in 2011, former Governor O'Malley issued an executive order establishing the quote-unquote Marcellus Shale Safe Drilling Initiative. Right there, we had the first sign of a problem. The very name of the initiative implied there was such a thing as safe drilling. But moving on, its stated purpose was to assist policymakers and regulators in determining whether and how gas production from the Marcellus Shale could be accomplished without, quote-unquote, unacceptable risks of adverse impacts to public health, safety, the environment, and natural resources. The executive order tasked the Maryland Department of the Environment, MDE, and the Department of Natural Resources, DNR, in consultation with an appointed advisory commission, with conducting studies and reporting findings and recommendations. But please note, no public health agency had any actual authority in this process, other than a single representative in an advisory capacity only. So out of 15 members on the advisory commission, 1 had a background in public health. And this was despite the fact that the executive order specifically addressed impacts to public health. So a number of studies were completed over the 3 to 4 year period as part of this process, but each of those had flaws. For example, the Best Management Practices Report, which formed the foundation for proposed regulations in Maryland, was developed before much data was available, as the authors of the report themselves state in the opening paragraphs of their report. and I'll clarify this further in a later slide. The report was also completed before the health study had even started. The other study, the second study mentioned here is a health study which was commissioned but funded late, rushed to completion in under 1 year, and honestly, the results, which I'll show in a slide shortly, were largely ignored. Very importantly, the economic study failed to quantify tourism effects or healthcare costs. Therefore, it could not truly answer the question about net economic impacts on our state. So despite these shortcomings, a final report from MD and DNR was issued in November of 2014 and stated that fracking could be done safely with strict regulations in place, creating a huge problem for us in Maryland. Those regulations were then released, the proposed regulations were released in January of 2015. A public comment period was closed in February, and everyone is currently waiting to see what the new governor, Governor Hogan, actually plans to do with these regulations. So it can be tough to sum up a 3.5-year commission process in 2 slides, but I thought it might be helpful to look at what went right and what went wrong with this commission process. In terms of what went right, citizens did become actively engaged in the process. People learned a great deal by going to the commission meetings, reading reports, talking with each other, and so on. In addition, and very importantly, the commission process bought us time for science to begin to catch up, as we'll see in the next slide. In terms of what went wrong, the agencies never answered the question of whether to frack, only how to do it somewhat more safely than in neighboring states. In addition, the studies were inadequate and out of sequence, as I described previously, and no health agencies had any authority in the process. Most importantly, the final conclusion that fracking could be done safely with strict regulations in place was unsupported by data, and in the opinion of many of us, simply wrong. Now, what happened since that final conclusion was issued in November of last year is where things really get interesting. 3 major unexpected shifts occurred late last year that changed the political and the grassroots landscapes entirely. First, the governor's race shook the political establishment. They were expecting the former lieutenant governor to move into the governor's mansion, but that didn't happen. And no one knew what this new governor, Governor Hogan, would do with the former governor's proposed regulations. Secondly, New York banned fracking. This caught everyone by surprise and was a huge boost to grassroots advocates. And third, and perhaps most importantly for this conversation, the health data really started pouring out. An analysis from physician scientists and engineers for healthy energy on impacts of shale gas development was released in December of 2014, along with the second edition of the compendium previously mentioned from Concerned Health Professionals of New York. So now the health professionals in Maryland actually had solid material to work with to justify a call for a long-term moratorium on fracking. What we see in this chart on this slide is the updated January 2015 analysis from PSE Healthy Energy that shows that 75% of the more than 400 peer-reviewed studies on shale gas development impacts have come out since January of 2013. That's essentially after most of the work was done on the Best Management Practices report in Maryland. In other words, our proposed regulations, which were developed from the Best Management Practices report, were based on very little data. Furthermore, of the studies that looked specifically at health impacts of shale gas development, 47 of 49, 96%, were showing risks or actual adverse outcomes. These were powerful numbers. Our task was now to find a way to get this information disseminated as quickly as possible, both to the public and to legislators, and to make sure that people understood that the proposed regulations were premature and there was no evidence that they could adequately protect human health or the environment. We reinforced this message by pointing out that Maryland's own health study, done as part of the commission process and paid for by taxpayers, also showed a high or moderately high likelihood of negative public health effects in 7 of the 8 areas analyzed. Specifically, air quality, healthcare infrastructure, occupational health, social determinants of health, cumulative exposures and risks, flowback and production water related, and noise. All of these were felt to be problematic from a public health perspective. The only low-risk area identified was earthquakes, and that was largely because there were no plans to allow injection wells for wastewater storage in Maryland. This Maryland health study was even referenced in the New York health report, yet it was largely ignored by our own agencies and our governor. In response to this new information on public health risks, as well as the change in political landscape, the groups that have been working on the fracking issue in Maryland quickly coalesced around a call for a long-term moratorium. An ad hoc coalition was formed consisting of major groups like Food and Water Watch, Sierra Club, Clean Water Action, Chesapeake Climate Action Network, Chesapeake Bay Foundation, River Keepers, and many more. A full list, now over 100 groups, can be seen on the website shown here at don'tfrackmd.org. But this coalition also included in a prominent way several health advocacy groups like Chesapeake Physicians for Social Responsibility, Maryland Environmental Health Network, the Alliance of Nurses for Healthy Environments, and eventually the Maryland Nurses Association and the Maryland Public Health Association. Leaders from these various groups created their own ad hoc group modeled after and with support from the New York group. We called ourselves Concerned Health Professionals of Maryland. Simultaneously, citizen groups in Western Maryland became revitalized by all the new activity going on. Their memberships grew quickly, new groups sprung up, websites and Facebook pages started appearing, and everyone stayed in frequent communication through weekly conference calls, listservs, and social media. What began with a sign-on to a position statement in support of a long-term moratorium evolved quickly into a coordinated effort to get a bill passed. It's important to keep the timelines in mind. The Maryland legislature meets from mid-January to mid-April, and our only hope of getting a moratorium at this stage was through the legislature. The new governor was on record in support of moving forward quickly with fracking, and there was no realistic way we felt we could sway him. So the Protect Our Health and Communities Act was introduced in both the House and the Senate in early February, calling for an 8-year moratorium on fracking. Concerned Health Professionals of Maryland drafted a detailed letter to the leadership of the General Assembly explaining our concerns and asking for their support for a long-term moratorium. Over 100 health professionals signed that letter, and it was delivered the same day as the press conference announcing the bill. The health professionals also spoke at the press conference, making it clear that public health concerns were the driving force behind the bill. Over the next few weeks, citizens in Western Maryland also developed a letter of their own focusing on the negative impacts on tourism and local businesses in Western Maryland should fracking begin. They managed to get over 100 businesses to sign on in a very short time frame in support of the moratorium, which has been a huge development in this campaign. It undercuts the previous narrative from the Chamber of Commerce and some elected officials claiming that fracking would be good for business in Western Maryland. You know, the jobs, jobs, jobs argument. While all of this was going on, the large groups in our coalition also mobilized their email lists and managed to generate over 20,000 email messages through the General Assembly. In a few short weeks, we've managed to turn fracking into one of the most visible issues of this legislative session. We've had press conferences, rallies, many visits to legislators' offices, op-eds, non-stop daily letters to the editor, and on and on. It's been a whirlwind of activity. And the bill's sponsor even read this quote from Dr. Zucker when he presented his bill at the House hearing on March 11th. Would I let my family live in a community with fracking? The answer is no. I therefore cannot recommend anyone else's family to live in such a community either. We actually don't know how all this will turn out yet. We're right in the middle of the most critical stages of the battle. In fact, we had a very positive turn of events in the House last Friday as the bill was passed out of the key committee following an amendment which converted it from an 8-year moratorium to a 3-year moratorium. Clearly, from a health perspective, 8 years was preferable. But realistically, getting a 3-year moratorium through one of the two chambers would be a stunning step forward. and a real testament to the power of grassroots organizing, focused largely on health and economic messages. I have to say this bill is actually being heard today in the House in Maryland. So if you want to listen in on the hearing, it's going to be going on shortly. We still have major hurdles to face in the Senate as well, so please stay tuned. We should know within the next 2 to 3 weeks whether Maryland will join New York in at least keeping fracking out of our state for a few more years. As more and more evidence of harms emerge, and as the economics of fracking continue to collapse, we are cautiously optimistic. In case people on the webinar are looking for additional sources of information on fracking, I offer these as a sampling of the many resources now available. In particular, Physicians, Scientists, and Engineers for Healthy Energy has 10 educational videos covering the engineering processes behind fracking and many of the health issues related to the process, including toxicology, occupational health effects, effects on animals, and much more. They also have a comprehensive database of peer-reviewed literature. They have 1 to 2 page summaries on different aspects of shale gas development impacts. It is truly a great resource. Concerned Health Professionals of New York has also published its 2nd edition of the 100+ page compendium that summarizes all the key studies, reports, and news articles from most recent to oldest, grouped in categories like air pollution, water pollution, etc. So I highly recommend people check that out. The 3rd link is our site, Concerned Health Professionals of Maryland, where you can find the health professional letter that was written to the Maryland General Assembly leadership, along with several letters to editors and other key studies. The 4th link is specifically for residents of Maryland who may be on the call. mdelect.net is a site you can type in, you can go to and just type in your address to find out who your legislators are and how you can reach them if you need that information. Finally, please feel free to contact me for additional information on what's happening in Maryland. I've given you my email and cell phone number. And finally, I'll close with this fun photo of an action we just took a couple days ago out in Annapolis. Doctor's orders, don't frack Maryland. Thank you so very much for the opportunity to participate on this webinar.
Thank you, Gina. I really appreciate that. And with that, that concludes the 3 presentations. We're going to turn to questions now, but I want to do a quick reminder then. If you'd like to submit a question, there's a box in the control panel on the right-hand side of your screen. Just enter your question and click Send Question to Staff, and we will queue those up. Additionally, before we go to our first question, I want to remind people and invite people to check out halttheharm.net. For people among our audience who might be interested in joining the network as a leader, there's an online application there, or you can just sign up as a supporter, and we'll stay in touch via email to let you know about future webinars and other events. The first question I'd like to go to is Leni, and the question is, should people and individuals who live close to unconventional natural gas development undergo any special kind of blood or urine testing to determine whether they've been exposed to harmful chemicals, and can they know that those exposures were related to the drilling operations that are near them?
We are frequently asked this question. Most of the chemicals associated with unconventional natural gas development or activity are cleared rapidly from the body, and they have other sources. There's others, and these may not have a measurable metabolite that's specific to the chemical of concern. So the results of the blood and urine test are often misleading. So a positive test may not actually be related to a hazardous exposure, or may have resulted from an exposure unrelated to unconventional natural gas activity. So it might cause an unnecessary worry, and a negative may result even when there has been an exposure. So if the testing takes place too long after the exposure occurs and the hazardous material or chemical has already been cleared from the body, it could cause false reassurance. So the concern is of a false positive or a false negative. The other thing is there may be an exposure to a chemical, but there may be no information available to interpret whether the results indicate that exposure and it poses a health risk. So consequently, we don't usually recommend that these tests be done we do recommend that individuals have routine blood and urine tests to check for their general health condition. And this would include typically a complete blood count, a comprehensive medical profile to check kidney and liver function, a urinalysis, and sometimes a thyroid test. And these results can help determine whether a person is experiencing health problems either from the environment or an exposure or another cause. So that was a long answer, but it's really important to think about the consequences of a false positive or false negative.
Thanks, Leni. No, long answers are needed for a complicated question. I'm going next to Sahru and kind of building on that. The connections specifically, well, Leni's described a broad array of health impacts. Can you tell us specifically the connection or why a breast cancer organization such as yours has focused on fracking as you have?
Sure. So as a breast cancer organization, we work on a number of issues that we think impact the breast cancer epidemic, and one of those are the exposures that we all have to environmental toxins. And we believe that fracking right now is one of the sort of important and growing pathways of those environmental exposures to cancer-linked chemicals. And so it's an important issue not only for breast cancer but for health harm in general. And it's why our organization feels like it's an important issue to work on. I think the compendium that I spoke about earlier gives a lot of really important sort of hard evidence and science that should give us cause to pause and really think about what are these chemicals that we are all exposed to, and how do we think about the prevention part? How do we think about, these are chemicals that potentially do have risks to increasing our risk for breast cancer and other health harms, and do we wait for those to harm us in the future and then do something about it, or do we take the information we know now and prevent those long-term harms in the future? And our organization thinks that we really want to be preventative and to work to prevent that future harm that we see coming. So.
Thanks, Sahru. The next question is for Gina. We've had a couple audience members ask about how does the information and results of studies actually get to public health officials and the politicians who are making these decisions, and how do we ensure that they actually pay attention? Your slide showing out how the number of studies has increased very recently, and yet seems like state by state there's an approach saying we're gonna wait for the science to help us determine whether we will pursue with fracking, and yet different states are coming to different answers based on what they're saying or the reports they say they're looking at.
That's actually a great question, and it is one of our biggest challenges, because one of the frequent refrains we hear from legislators is, we've studied this enough, 3 years was fine, which, it's time to move forward. And actually that's ridiculous. If you think about how long it can take for different disease processes to develop, we simply haven't had enough time yet from time of exposure to time of development of certain kinds of illnesses to be able to even document some of these in the peer-reviewed literature. What we're starting to see are some of the shorter latency effects showing up now. So what we've tried to do is, we actually have a group of health professionals who make up 1- and 2-page documents in hopefully fairly straightforward language, using some of these resources provided by PSE Healthy Energy and some of the others that have been mentioned, and we deliver these to legislators. We write letters to them, we hand them things in person, we get people to quote them in letters to the editor, in op-eds, etc. So it's a very organic process of trying to get out this key information. And I think that the data that showed 96% of studies actually looking directly at the health effects of fracking was a very powerful pie chart and very powerful statistics that we have quoted over and over and over again. So it's really a process of repetition. certain key messages, I would say, in every media we can find to do it.
Thank you. I want to carry on a point you've made because they've been mentioned a couple of times. PSE Healthy Energy is physicians, scientists, and engineers for healthy energy. And on their website, you'll find a tremendous collection of publications, reports, resources of some of the studies we've talked about here today. And it's a terrific resource for anybody who's looking to find the real peer-reviewed type of research that's going to help any advocates make their case about the impacts of fracking. Along those lines, we've got a question from the audience who asks, are there any particular major universities who have been at the forefront of researchers' studies when it comes to the impacts of unconventional natural gas development? That's for anybody.
Well, there are many different universities involved. I know Johns Hopkins has some studies underway right now. We're waiting to see some of those results, working with Keiser. Certainly Cornell has been at the forefront, University of West Virginia, Colorado. There are many, many universities in Pennsylvania that are working on this. The difficulty sometimes is that there's a tremendous lag time between the time that they start conducting studies and the time that the public can actually find out the results of those studies. And this has been a real problem for us because much of what we know has been through much more informal networks, going to conferences, listening to people who are in the field and starting to collect the data before it's actually made its way through peer review. So my suspicion is we'll see much more coming out in the next few years, but it has been a real challenge to even figure out what is in the pipeline and when it's expected out.
I see. Well, two kind of follow-ons, combined questions, and one is about government as a source for studies. Is the National Institutes for Health doing any studies on fracking or health effects, or the environmental protection agencies? Have they been engaged in this study and research as well, or less so than the universities? And following on that is, you mentioned the growing number of studies and the updated compendium. Is there any single most convincing study, or is it more the collective impact of all of them?
Anybody else want to take that?
I think one of the difficulties is that when we were dealing with tobacco, there was one source of a contaminant. When you're dealing with unconventional natural gas development, there are several sources of disease. There are several sources of environmental contamination. You have air, you have water, you have soil, and there are so many different routes into the body. And the other thing is it takes such a long period of time to say, okay, cause and effect, and to have clusters of a disease. So I think it's a lot more complicated of an issue than we have had with tobacco or lead or asbestos in the past. I think that's something to take into consideration also, that it's a very complicated issue. Not
Sure.
to even mention the social stressors. We didn't even talk about the changes in community, and I accidentally went over a slide that talked about the stressors, the mental and emotional health issues related to the fracking with the changes in communities and the changes in family dynamics. So there's just, it's more complex than I think what we've had before with environment. I'm sorry.
No, I was just going to add to that. That's absolutely true, Leni. The other issue that we haven't discussed is that much of the information is hidden from the public and from researchers because information about the nature of the chemicals being used is not freely available. They like to hide behind trade secret designations. In many cases, people who have been harmed or believe they've been harmed by fracking chemicals or other exposures related to the life cycle of this process often have to sign non-disclosure agreements with industry in order to get, payment for water or to move away from the area, whatever it might be. So there are many factors that have actually slowed down our ability to get good information about this, not to mention, of course, the political side of it, which has really tied the hands of the EPA, for example.
Yeah. I've got another question. I think we've spoken a bit about exposures near drilling locations, but one gentleman who says he's on the board of a local health department who has a pipeline going through his area, and the concerns about exposures not necessarily just from the drilling location, but along the whole path of the delivery of natural gas. Can anybody comment on different types of exposures at different places along the way?
Well, anytime there's a break, anytime there is metering stations, I mean, there's times for emissions. The other thing to think about is the pipelines and the control of vegetation often involve herbicides that could be sprayed over and then go and contaminate. So it's another type of contamination that people may not be thinking about.
I think
In
there's
addition,
also,
I was just going to add, in addition, when we're talking about fracking in this context, I think most of us are actually not talking just about the drilling and the fracking, the breaking up of the rock. I think we actually are talking about the full life cycle of all the truck traffic, the mining of the silica, the compressor stations, which run 24/7 and emit volatile compounds. You know, there really is, and I think Leni showed that in her slide, there are really many pieces to what we're talking about when we talk about fracking.
And the noise and the light and the vibrations, I mean, odors, all of that. You're right.
And I think it's not, I mean, there are specific issues that are different when we're looking at drilling sites or even sort of the pathways to and from drilling sites, but it's an issue that affects all of us, whether we're near a fracking drill site or not. And I think that's a really important thing to understand, because there are issues around sort of dealing with the immediate harms of communities that are impacted because they are just by proximity right there. And there's the issues of sort of the larger preventative. We are all affected. This affects all of us because it impacts our air, our water, our soil, our sort of everything.
One question that we have from the audience about studies, and we've been talking a lot about the growing number of studies and the consensus among them, is the industry sponsoring research that contradicts these studies? Have there been arguments or studies that seek to discount some of the impacts that you've all witnessed?
Conflict of interest is a big one. I mean, I think it's really important to understand when a study comes out that is contradicting much of the literature that's coming from places where, you know, that there is no conflict of interest, is to look at who's sponsoring, who paid, who funded, where is the study coming from, to understand, you know, you can take data and manipulate it to say many different things. And so it's important to understand where the research is coming from, who's funding it, and is there a conflict of interest.
Yeah, always consider the source. Another question, again, this is more about kind of the life cycle, a question about wastewater hazards and the chemicals that are present in fracking wastewater, and how different localities or different states vary in their treatment of such contaminated water.
Well, that is an issue that is very complicated. I mean, it's interesting. The chemicals that go into these wells, and, you know, if they're putting 5 million gallons of water into a typical fracking well, and roughly 1% of that is chemicals, that's 50,000 gallons of chemicals, many of which are toxic, as we've discussed. When that stuff comes back out of the well, it brings with it not just the toxic chemicals, but also radioactive materials and heavy metals, which are also toxic. So, and a lot of it, maybe 30% of it comes back up, another 70% of it remains down below, and we don't know what's happening to it. We do know these wells leak. We do know that spills happen, and we do know that there are not really adequate ways to treat this wastewater. So the wastewater issue...
And the other thing we don't know is...
What?
Go ahead.
No, that's what I was going to say.
I was going to say, oftentimes you can also have two chemicals by themselves that may not be toxic, but when they come together, form a very strong toxin.
Right.
And, you know, and we're not, and even if two chemicals by themselves are not toxic, we don't know what the combination of these chemicals together can cause.
So in short, that's an unanswered question in terms of what to do with the waste.
It's very complicated. It's extremely complicated.
Well, we're at time. It's just past 2:30, so we're going to end there. I want to thank all of our panelists today for your presentations and for your information, each of you for sharing your contact information. We will keep this webinar, recording of this webinar will be made available online, and so we'll share that information there as well. I also want to let our audience know that we've scheduled our next webinar, which is going to be on April 8th, and the topic is going to be the Advocates Toolkit, apps and websites of use to advocates who are working to fight the harms of fracking. And lastly, a reminder, anybody who's interested in learning more about the Halt the Harm Network or potentially joining the network as a supporter or a leader, we invite you to visit halttheharm.net. And with that, we will sign off and say happy Monday, everybody.
Thank
Thank you, Chris.